Renault from the Royal College of Psychiatrists, and Suzi Talbot, who has lived with eating disorders since she was a teenager. Thank you so much for coming on and talking to us a little bit about it. Suzi, can we come to you first of all? Tell us a little bit about your experiences of sort of moving through the NHS with what you have been through over the last few years.
So I first sought help when I was maybe 14 years old, but it was about 16 years ago, and it was sort of send you to a counsellor, and it wasn't eating disorder specific. So I very quickly carried on with those habits, and it was 3 years ago that I finally sought help, and it was after my cousin had taken her own life, and I kind of started to get panic attacks and anxiety as a result of I think the grief and some of the shock, and I started to faint, and that was because I wasn't nourishing myself properly. So I went to get help from the NHS, and they sort of targeted the eating disorder first, but it was a little bit of a struggle to get help.
But to get them to understand, or to actually get the access to the care that
I
you
need
needed?
to get them to understand at GP level, and I appreciate that GPs have to be the first port of call for every single illness, so they can't necessarily understand everything, but to get them to understand what I needed, and even to have face-to-face appointments with them. Once I got in there and got the help and sort of got with the psychiatric team, then it was a different story. But then once that kind of formal treatment stopped, that's it. You were almost cut off. There's no additional support group for if you just need a bit of additional help. You're left a bit stranded.
Let's talk with you, if we could, Dr. about specifically the beginning of that sort of journey that you had, and many other people will have had the same kind of issues as well. When people are going to their GPs, we talked a little bit earlier about a very short amount of training given specifically for eating disorders. Is that one of the problems?
It is. Can I just first say thank you, Suzi, for sharing that. It's so crucial and really important to hear from people who've actually suffered with the illness. And that lived experience, I think, is crucial not only to help us develop services for the future and improve them, but the training. So one of the important things in training is, yes, academics can train, but it's also, I think, really important to co-develop our training with people who've actually had lived experience. That voice is really important in terms of recognition, early warning signs, symptoms. So yes, you're right, more training across the whole workforce, not just for specialists. So our GPs in primary care, but earlier than that, at medical school, at university, at undergraduate level. I think you mentioned, some places there's maybe perhaps an hour or 2 hours of training. That has to improve, that has to increase, that has to get better.
So did you have to do your own research? Were you given much sort of...
When I was at medical school, in eating disorders specifically, very little training. We wouldn't accept that for diabetes or for cancer, and we must not accept that for all mental health, particularly eating disorders, because it's a serious illness, it's a serious neurobiological illness, and people do lose their lives from this. So it isn't just doctors either, in terms of the workforce. I think really importantly, Suzi, I think I've heard you say that it was quite difficult to go to your GP as well because of the shame. We need to train other professionals that you would come into contact with, walk-in centres, accident and emergency, the wider primary care, even our dentists and dental nurses, because that's one of the physical consequences of eating disorders can be difficulties with your dental hygiene. So the more that we train that wider workforce to recognise and to understand, then they can get people, hopefully, that support and help more quickly, because early intervention, again, what Suzi is saying, is really crucial. We may not have a cure for all eating disorders, but we can get people much better if we intervene more early, and the Royal College has done a lot of work around early intervention and their early intervention report. So we need to get better at that screening and detection.
Suzi, would earlier intervention have helped you, do you think?
Yes, I think so. I mean, there was a couple of times I'd gone to the doctors and said, I've got really bad acid reflux and I have a history of eating disorders, and they went, here's a prescription for some antacids, rather than going...
That was one of a key sign, would it?
Yeah, and I admitted it, and I think there was probably a few points where I was asking for help and no one really heard, but I think you have to be ready to change, and that's a bit of a cliche. But I think with eating disorders, that point when you're at your lowest and you can finally admit that you need help is quite a rare one. And if you've admitted it and you've gone through all that shame, as you say, of saying you've got a problem to a complete stranger, if you're then waiting a significant time for any treatment, the eating disorder voice gets louder and it says, no, you've got this. This isn't a problem. You can solve it yourself. You don't need help, or you're not worthy of help. You're not as bad as someone else, and they need the help more, and you start to back away, which I think I could have done had I not had sort of my family around me saying, no, this is a problem. You know, you're fainting at work. You know, this is the time you need help. And I think that's why it's really critical that even if there is a waiting list for treatment, that there is some kind of regular and compassionate and sympathetic contact from a medical service, because I found the lack of compassion and sympathetic language perhaps used by doctors quite difficult.
Can I ask you, just saying to your doctor, I'm struggling with this, but actually I've had eating disorders in the past. How big a moment was that for you to actually admit that? Really big.
And then because the doctor doesn't take it seriously, you think, well, this can't be a problem. Yeah. It can't be serious. Okay, that's fine. I'll keep on with the behaviours that I was doing that were, in respect now that I've gone through the treatment and recovery, they were significant and they were traumatic and bad for me, yeah.
I'm sure lots of people will relate to what did you call it, the eating disorder voice, did you call it? Yeah, I'm sure lots of people will relate to that. Thank you both very much indeed for your time this morning. Thank you.
Do let us know what you think about that as well. We should say that a Department of Health and Social Care spokesperson has told this programme that we know early intervention is vital. Health Education England is currently working with experts to review training and education resources and help professionals spot the signs of eating disorders and act quickly to diagnose and treat it. That's we asked them for their comments this morning.
Just to let you know as well, for details of organisations which offer advice and support with eating disorders, you can go online to bbc.co.uk/actionline.